to talk to Nicky Mandall and Mariyah Nazir, who are orthodontic consultants in Manchester. I'm here to talk about the paper that they submitted to Journal of Orthodontics, which won the Journal of Orthodontics Scientific Paper of the Year prize this year at the British Orthodontic Society Conference. So Nicky, what were the main findings of your study?
The main findings were that the banded attachments were stronger and fell off or debonded less often than bonded attachments, which are the small metal squares that we attach to fixed appliances for patients. And this is important because if there are breakages during treatment, it means that treatment lasts longer. And if the treatment lasts longer than, say, 2 years, patients are at increased risk of decalcification, which is damage to the enamel, or possibly increased shortening of the roots or root resorption. So as orthodontists, it's in our best interests that the treatment is completed as quickly as possible and that the appliance doesn't break during treatment. We didn't find that there was any protection against decalcification from the bonded attachments, which are smaller and theoretically easier to clean, which was perhaps surprising. We would have thought that they would be better at preventing enamel damage. But interestingly as well, there was no difference in discomfort between the two types of attachments. So from our patients' point of view, they were equally happy with the comfort levels.
Thanks. So Mariyah, why did you choose to do this project?
At the point that we started carrying this out, the question hadn't been answered in any purely, truly scientific way, which is the better attachment. So as clinicians, we were going by gut instinct, what do I prefer to use? So we felt it would be pertinent to our own clinical practice and to the greater clinical practice of orthodontists to actually have some scientific basis behind the choice you make, especially if it impacts on a patient's quality of care and any side effects that might be involved. And the study design reflected that. We thought it needs to be a clinical trial that includes not just secondary care hospitals but primary care facilities as well. And we thought we'll do a study that is reflective of all of us orthodontists working at different levels in different areas, rather than being esoteric and only being able to be applied to a specific place at a specific time.
Right. So once you'd finished the study and you came to submit your paper to the Journal of Orthodontics, how did the submission process work with Maney?
Maney has very clear guidelines for scientific papers, how they like them to be formatted, what the content should be, what you should submit in terms of ethical approval and consent, etc., etc. So the guidelines are there, and there are previous scientific papers to look at and see how did another person format their particular research study. Then everything is led online by the guidance, so the submission is a really streamlined process, and within 6 to 8 weeks the submission, the review, the corrections and the resubmission are processed, and the rapport and the feedback is constant and clear, and I just felt it was very well supported. The idea being you want the impact to be quite soon between the findings and dissemination, and having such a streamlined process really enabled that to happen.
Great, thank you. So where do you carry out your clinical research studies?
Well, we lead the clinical trials in the orthodontic department here in the Tameside Hospital Foundation Trust, which is between Manchester and Sheffield. Mainly in the hospital, as Mariyah said before, it's people who require multidisciplinary care, which is orthodontic appliances with either facial surgery or implants. We also wanted to extend our sites for research and recruitment to primary care, as most orthodontics is carried out by high street specialist practices in the UK. So thank you to Susie Matthew from Lancaster and Dee Fox from Lytham, who helped us recruit patients.
So what other orthodontic research is going on in the UK?
There is quite a lot going on nationally. We run and lead a clinical trials group which is for the whole of the UK from here, which has 8 other consultant units and hospitals. The professional organisation British Orthodontic Society also supports research through the Journal of Orthodontics, which is sent to all members. That's, as you know, published by Maney Publishing and edited by Professor Martin Coburn. There's also something called the British Orthodontic Society Fund, which is from charitable donations from members, and money is raised through various fundraising activities. And this funding is used to support research projects nationally. It's mainly for people who are starting out in their academic career or early researchers.
One of the things that the British Orthodontic Society are planning on funding next year is one open access article per issue of the Journal of Orthodontics for a chosen paper in the issue, particularly randomised clinical trials such as your banding versus bonding paper. So we're hoping that your prize, along with the funding that the BOS are going to provide for these open access papers next year, will encourage more people to submit randomised clinical trials like yours.
Thank you. Can I also take the opportunity to thank Nicky Publishing for their support and generosity in this prize, the Scientific Paper Award that they support is well appreciated.
And congratulations to you both.
Thank you.
Thank you.